My name is Janet Mee. I am a measurement scientist at NBME. Welcome to this session titled Testing 1, 2, 3, where I'm going to show you how my colleagues and I use the GenAI Lab to advance medical education. Now, before I get started into what we actually do with the GenAI Lab, I wanted to share with you a little bit about NBME. You may not have heard of us, but you've definitely experienced our work. So NBME stands for the National Board of Medical Examiners, and our mission is to advance assessment of healthcare professionals to achieve optimal healthcare for all. And so how you might have interacted with us. Our flagship product is the United States Medical Licensing Examination, USMLE. And that is the test that people graduating from medical school with an MD degree take to get their license to practice medicine. So if you have seen a licensed MD physician, that physician has passed the USMLE, which my company makes. So though you may not have heard of us, you have experienced our work. And similarly, the field that we work in, medical education, part of that and part of actually your experience as well is educational measurement. Now, this term may be new to you, but you are not new to educational measurement. Educational measurement, defined easily, is the systematic process of collecting and interpreting knowledge or information about what you know, what you can do, what skills you have. And so educational measurement encompasses everything from your third grade spelling test, right? Your high school algebra test. Did you try out for a sport? That's a type of measurement as well. Not what we usually deal with in educational measurement, but it counts. If you've ever taken the GRE, the SAT, maybe a certification exam, that is also educational measurement. We use tools, assessments, surveys, sometimes even observation to learn what a person knows or can do. And a huge aspect of our field is accuracy and fairness. And you can see, working in the field of medical licensure, like NBME does, why it's important we're accurate and fair, right? You would like a physician who really knows what they're doing, right? It's important our test questions can accurately assess their knowledge. And fair, you want someone who's a physician who passed the test because they had the right knowledge and skills. Not exactly because of extraneous characteristics. So again, you may not have heard of NBME, but you've experienced our work. And you may not just have learned about the field of educational measurement, but you've been a part of it for a while. And so what I'm hoping to do in our next 10 or 15 minutes is to show you some of the tenets of measurement, some of our tips and tricks that we've developed as a field to how to best ask questions. And so stay tuned. I'm going to go over a couple scenarios where I'm going to show you how we can apply some educational measurement principles to make sure that you do this, that you can do this well with the GenAI Lab. So stay tuned with me. Hang on. I'm going to talk about 3 different scenarios that NBME has used the GenAI Lab to really enhance how we measure and how we assess medical students. The first one is classifying very short answer questions. Not short answer, but very short. The next, I'm going to talk with you about how we assess clinical reasoning constructs in medical student and patient dialogues. And then finally, how we evaluate item content. There's a lot of work that goes into questions before they end up on a test. So I'm going to show you some behind the scenes things and how what we do in educational measurement can really help you with your annotation in the GenAI Lab. Now, before you get too excited and think, my daughter, nephew, someone I know is in medical school, and by watching this presentation, you're going to get them an edge by seeing behind the scenes, maybe some extra content. Everything I'm showing you here is AI generated. I will not be using any student responses that are real. I'm not using real item content. That is all proprietary for reasons you can understand, hopefully. So let's get started with very short answer questions. And within the GenAI Lab, this would be considered a classification task, and you'll see why. For large-scale testing and even classroom tests, you've probably become very familiar with multiple choice questions, right? Here's an example. Which amendment to the Constitution guarantees freedom of speech, religion, press, or assembly? You may not have known the answer off the top of your head, but with some options, you're probably going to get this right. However, it's a very different cognitive process for you to respond when you don't have that list of options, right? You might have to think a little more. Right? Instead of identifying the answer, you're going through a process in your head to come up with it, using what knowledge is in there, what skills you have. And it's really the same in medical education, right? This is a sample test question that we might have about a 58-year-old man who goes to the emergency department with some chest pain, right? This item gives some information, talks about vital signs, and some lab results. And then we ask the medical student, which of the following is the most likely underlying cause of this patient's symptoms? Now, they might be able to just, guess or, look at some words in the beginning of the item and say, wow, there's a lot here dealing with the heart, right? And maybe I'll pick coronary artery disease. It's a very different question when all they have is a blank line and have to come up with this. And I don't know about you, but when I go to the physician and I'm sick, I usually don't bring along a piece of paper on which I've listed possible, things that could be wrong with me. Patients don't present with 5 response options. We're kind of a blank slate, and so this is considered a more authentic assessment, right? Instead of, providing a list, having the student come up with the response really is more real to life. And that's why we like questions like this. One of the reasons that in educational measurement, we also don't like questions like this is because of the response. God love our students. They will give every character they are allowed to give when answering short answer questions, right? Just by looking here, these are very realistic, though not authentic responses that we get. You can see one student entered coronary artery disease, one. Everyone else gave us a whole bunch of stuff, including the lovely student who said IDK or I don't know. Clearly, this is not a job for humans to score all this. I believe last year, the United States medical licensing exam had about 150,000 administrations. So even if we just had a few of these questions on the exam, it's not feasible to score with humans. We need to use AI. And AI, as we know, really benefits from some training data. And we get that through annotation. And we also have to verify our AI models. Again, we need some human input. And so one of the things we do in assessment is develop scoring rubrics. Now, these may be called instructions. We call them scoring rubrics, and they're really defined. When we give our subject matter experts the scoring rubric, it tends to be very comprehensive. We list what the possible categories are. Again, in the GenAI Lab, these are our labels that we use for classification. And we define, right, what does it mean to be correct, incorrect, off topic, right? We give sample responses, making it very clear, hopefully, what these classification categories mean. And we also give some instructions at the bottom, right? Minor spelling or grammar are acceptable. These really help our subject matter experts with their agreement and understanding the task. So what does this look like, or what could this look like in the GenAI Lab? One way to do the classification task is one at a time. Okay, viewing one task at a time. And you can see here we have, the correct is green, the incorrect is red, bringing back that red pen, showing what's wrong with our essays from high school, and then off topic. Now here, this is just one task at a time. What we really need our subject matter experts to do when they're annotating is to make sure that they are consistent, right? Just because someone can't spell coronary artery disease, we still want them to get it right. And so we need our subject matter experts to make sure that as they're going through the list of responses, they are as consistent as they need to be, which is why we really like the compressed view. We love the compressed view. First of all, because it starts out giving the instructions. Our subject matter experts have no choice but to read these instructions as they're starting their task. And then presenting up to 50 responses on a page helps with their accuracy so much. Our subject matter experts can scroll up and down, making sure that at the beginning where it says pulmonary embolism, maybe they give that an incorrect, but then later someone writes embolism-pulmonary, they can scroll and make sure that they're being consistent, right? This compressed view aligns more closely with the cognitive processes that we're looking for our subject matter experts to do. Just by changing the layout, the tiniest bit, we both know this is 2 clicks of a button in the GenAI Lab. It really facilitates the cognitive processes that we need our subject matter experts to do to provide consistent and accurate classification. So this is just one example of how we do use the GenAI Lab to make sure that we are scoring our very short answer questions accurately and fairly. Getting back to some of those educational measurement principles. How can we, again, it's really answering the question, how can we get the information we need from our subject matter experts in a way that reduces their cognitive load, makes it a faster activity, right? There's fewer button clicks doing it in this view, and lets their knowledge, skills, and abilities shine through. And we're going to continue this topic of, aligning the layout and the task with the cognitive abilities as we move to talk about identifying clinical reasoning constructs in medical student-patient dialogues. And here I know we're focusing on medical students, but you can see how this very, very quickly applies to real medical practice, right? The conversations that happen between providers, whether they be physicians, nurses, technicians, and patients, is critical in providing high quality healthcare. So that's why we start with medical students, right? Let's get them trained well. And for medical students, we do a lot of performance assessments. A performance assessment allows someone to demonstrate their knowledge, skills, ability in a real life situation. So for example, you've already done a performance assessment if you have a driver's license. The road portion of the driver's test is a performance assessment. If you have CPR certification, you've also done a performance assessment. And kind of a simulation for CPR certification. You don't practice CPR on someone else in the class because it's too dangerous. You could hurt them, right? And that's what we do a lot in medical education. We don't want our students to, practice surgery the first time on someone who really needs surgery, right? Simulations allow this. One of the ways we do this is with standardized patients, right? We train lay people to pretend they're Mr. Jones who is having trouble sleeping at night. And that patient acts the same way with student after student after student, right? Which allows us to have a consistent way for students to show their knowledge, skills, and abilities. But again, like the short answer questions, how do we evaluate this at scale? We know the answer to this, people. It's really the answer to most questions these days. It's AI. So let's take a look a little deeper at this. When we talk about clinical reasoning, I think it's safe to say that we could have one definition of clinical reasoning for every physician in the United States. It's kind of difficult to describe, but for the sake here, I've just said we're going to look at data gathering and problem representation, right? This happens when you see a physician. Hypothesis generation and differential diagnosis, right? You see a physician and the doctor says, well, I think it could be the flu, but it could also just be a virus that's going around. Right? And then interpreting and explaining, right? Maybe you take a flu test and the doctor says, great news, it's not the flu. So these are all elements of clinical reasoning. And we look for them in conversations between patients, our standardized patients, and our medical students. So let's take a look here at how we might do this using the GenAI Lab. And this is actually how we do it in the GenAI Lab. It's great that we can control the label colors because we can make all of the our annotation labels that relate to a certain construct one color, right? Very useful, very handy, easy to look back at the transcript and say like, wow, we can see where this construct happened early or this construct happens later in the conversation. And that helps us see into the medical students' knowledge progression, their reasoning as they're going through this case. And here I've presented the dialogue. Now, for this particular task, we're interested only in what the medical student says, right? We don't need to evaluate the standardized patient. They're trained, they're doing their job. But what are the students doing? And just by looking at this, someone could definitely annotate this. However, if we use the functionality in the GenAI Lab to implement some HTML, a little XML, it can look different. And let's talk about how just using a table and some bolding can really make this cognitive process easier for your annotators and increase the quality of the data that you're getting. So all we did was put the data into a table, bold the student text, right? Number one, make it very clear when the student is speaking, because this is what we want our annotators to annotate. So let's make it look important. Another thing we did was add the row number. Again, we want our subject matter experts who are annotating to be accurate, right? So usually what we have them do is we do some training and the annotators will go through and annotate independently. And then we have them get together and discuss their annotations to make sure that they're agreeing and applying the rubric the way we want them to. Just by adding row numbers, it can make it so much easier for our subject matter experts to discuss, right? Instead of being like, the fifth time the student speaks, it's a lot easier here for our subject matter experts to go, hey, can you take a look at line 5? I don't have an annotation there, but you do. Again, the GenAI Lab's ability to use different types of formatting and layout can really make this process less onerous for your subject matter experts. Use the GenAI Lab to optimize our data collection procedures as we build that training data for our LLM. And finally, I'm going to talk about how we actually use the GenAI Lab for something not related to annotation. But again, it speaks to the flexibility of this platform, its possibilities, and how you can use it for things you might not be thinking of. Note, this following layout was created by one of my colleagues, Saed. I take no credit for his brilliance. So NBME has just released a communication learning assessment. That's a thing, communication learning assessment. This is an app-based assessment in which students can view a recording of a patient who has a complaint or is struggling with something or just having a regular interaction. And the medical student watches that video and records a response to that patient. these students can then listen to their response and learn about what the good characteristics of a response could be. What are those ways they can communicate that really focuses on the patient and delivers accurate information in a caring and respectful manner? So if you're interested in this, there's a little URL down there, nbme.org.cla. Check it out. And since this is a new assessment for us, one of the things we're doing is developing new content, right? We need to make sure that these cases that we develop, these vignettes, really represent scenarios that occur in medical practice and that these scenarios are accurate. So let's take a look at how we use the GenAI Lab for this. One of the things we focus on is, at the moment, whether or not is patient communication activities related to fostering the relationship, gathering information, and providing information. This is from, this table is from an article that one of my colleagues published, specifically related to this assessment. And you can see, again, we kind of have this, like in clinical reasoning, this overarching constructs, but the lower level skills that we're looking for in the annotation. I'm looking for within our content. And so as we're developing new vignettes, we rely a lot on expertise from our medical community, right? Medical educators across the country with their different knowledge and skills and experiences, we need their input. And we're not flying them all to Philadelphia where NBME is located. So the GenAI Lab provides a really secure environment for us to share our proprietary information and get feedback on it. So let's see how my colleague Saed used the GenAI Lab to get information on these constructs as it relates to content development. So again, he relied on HTML and split the screen into two. Right? On the left side, we display the case vignette. Again, this is the same vignette you've been seeing all along from our short answer question. We have this 58-year-old man, and then here's what a patient might say. A patient might say, I don't see what my diet has to do with this, right? I'm having chest pain. Why do you care about what I eat? And then we provide some example responses so that the students can see what a strong response to a patient like this might be. And we think we should test this out with our subject matter experts, right? And so we ask them on the right side, a totally different scrollable window, right? Do we need to make any medical changes? What level of changes are needed? And because the screen is split, we can provide a lot of information that the subject matter experts can look at while responding to their questions. And because the GenAI Lab offers so many ways to collect information, we're able to provide a classification test, right? Really, this is a multiple choice. What changes do we need to make? No change, minimal, moderate, and collect comments from our subject matter experts. This has really changed how we can just get information about our content from a wide variety of people in a very secure manner. So is this annotation? Not really. Is it crucial to our business? Absolutely. So to wrap up, I just wanted to say the GenAI Lab has been a great partner for NBME as we work on our AI pipeline so that we can do scoring of different types of assessments for medical education. We're able to customize our layout to reduce time and cognitive load for our subject matter experts, right? Really aligning their processes with the task that we're asking them to do. It allows us to display text that directs the SMEs to only do what they need to do and look for patterns. And then finally, we use the GenAI Lab for something it was probably never intended, but does a great job at, right? Because we can collect data with flexible layouts and data types. So I hope you've learned a couple tips and tricks from those of us who spend a lot of time thinking about getting information from people. Hopefully you can use this to increase your annotation processes. Thank you for your attention. I'd love to hear from you. You can reach me at jme@nbme.org or LinkedIn.